Okay, now we're unmuted. Rob, can you hear us talking?
I can, thank you.
All right, sorry.
That's great.
Hey, we can hear you too. This is amazing. Okay. All right, thank you. Okay. I think we're set.
Good.
Geez, love this.
All right, we will call to order the Edina Community Health Commission meeting on Monday, July 12th, 2021. And we will just go around the room and do roll call.
Okay, you start.
Julia Sellies,
Michael Wood.
Andrew Hawkins.
Tracy Nelson,
Greg Wright.
Easily, Ellen Mullen.
Mary Ann Salon.
Philip Kinglow.
Okay, and I'm Jeff Brown, staff liaison. And on the phone is
Rob Lesh.
Rob. Okay.
All right. So we will, as you can see on the screen, we have our agenda for approval.
Move to accept. Second.
Those in favor?
Aye.
Anyone opposed? Do I need to call out Rob? Rob, if you are opposed, you can speak up.
Not opposed.
All right.
Okay. Now this is your chance now to say aye really loud when you get to do this, because we haven't been doing that.
That's true.
All right.
Okay. So meeting agenda is approved, and so we'll approve the minutes from our last meeting, which was June 8th, 2021. That's up on the screen.
Actually, it was June 14th.
Yep. Is that wrong? June 14th.
That's what happens when, yeah, no, June 14th. So we will edit that on the agenda, but it is correct.
Oh, yeah, you're right. Sorry,
Um,
my bad. Motion to approve.
I'll second it. Everybody who is in favor?
Aye.
Aye. Anybody opposed? All right. The meeting minutes for our last meeting, June 14th, have been approved. Any community comments? I don't, now that we are open.
Yeah, we have to have it back on,
Yes,
so. No one's here,
no one's here.
no community count.
No community comments sent to you at all?
Nope.
All right. Reports, recommendations, I'll just keep moving on. The opioid initiative report update. Looks like if you click on that link within the agenda, Rob, I believe it is attached.
Yeah.
Start.
Okay. Well, the opioid work group has a report that we are forwarding to this group for review with background information, which we've updated several meetings about. So this is consistent with what we've talked about. And in terms of looking at that, we were asked to look at the increased really deaths related to opioids. And so we relied heavily on the Hennepin County Works report related to this topic. The framework that's referenced is from 2020. And then we also have referenced in here information from other city websites. And the key finding from this, as we've stated before, is that there are, at the local level, at our level here, the key action that we can take relates to prevention and actually, am I right about disposition, specifically related to disposition of unused opioids, and that information is not very well gathered from the website information we have on our website as well as many websites. And so one of the key ways to prevent overdoses is for people to have safe storage and disposal of unused opioids that are in their homes. In addition, there's a public education part of it. And so this is, those are the key components of the primary prevention that's addressed in the 2020 report. And so what we've done is to lay that out and then to identify at the end some conclusions. And I think that those would be the ones that would be most close. I'm not sure people had a chance to read this or not. But one of the things that we found is that municipalities are not really using city resources to provide visible information about this. Our various websites, as I was stating before, do not really highlight this. It's very difficult to find on our website. And most of the information is housed within the police department. And I'm not, I've talked with a lot of people, and I don't think people would necessarily go to the police department to figure out how to get rid of their unused narcotics and opioids these days. We also had an outreach to the Edina school system and learned that it was not a strong focus of health classes there. And then we also talked about in the fourth item there, that the lack of visibility of information and information that is available. There actually are disposable little envelope things that folks can use that are available free of charge from our city. A lot of people don't know about that. And you can just literally toss the meds in there and then just throw them away. It's actually pretty simple, but it's pretty hard to find. It's also hard to find places like there are only 2 drugstores within our city where we can go to dispose of opioids. And so that was the finding of this. I happened to be having a conversation with a friend today, and it was consistent here that they had gone over to some drugstore, couldn't get rid of the stuff, didn't know where to go, and so then they just threw it away. And so that's part of what we want to also get out, is like, where do you properly dispose of this? So anyway, that's what we've laid out to bring that report forward to this group, and then to be forwarded to the
council, yeah.
for consideration, and then further detail about how this, kinds of things. Or do you have something else you'd like to add?
Well, the only thing that I would point out with a little emphasis is the work plan called for a review, but not specific recommendations, but it seemed to make sense to Mary and to me to suggest to the council that we continue on this path by having them actually ask for recommendations as part of our work plan for 2022.
Yeah, that makes sense.
And that's point 4 conclusions, but
At some point last week, I did see a tweet from the state's attorney general that because there has been a lawsuit, that apparently one of the deals of the lawsuit is that that company is going to have to speak openly to the state of Minnesota and tell them the truth about those opioids and how dangerous they really are. So that's something that is apparently coming at some point. So I did see that on our Twitter page recently.
Purdue.
Yes, yep. Yes, they're gonna have to give a public accounting of all this.
Were the pharmacies, was it the same company, the two in Edina?
There's one CVS and one
Walgreens.
Walgreens, which happen to be practically in the same parking lot on York Avenue,
Oh, okay, yeah.
which is also where the only governmental disposal is, which is in the Southdale Library. There are 3 places in Edina, and all of them are as far from the population centers of Edina as one could place them. And in, the 50th and France area, in this area, in the Southdale area, I think
those ones are 24-hour pharmacies. And at one point, I think that those might also be linked with sharps disposals.
Yeah.
At least they used to be, I don't know.
yeah.
I would also say that one that's in SelfFeel is not exactly the easiest thing to find, sadly. Unless you know exactly where to look. It's not like there's a sign pointing you in that direction that I can remember. So,
And speaking from experience, trying to get rid of them, it would be helpful, I think, to partner with hospitals, hospice care, places like that.
yeah,
Those are a lot of the folks that are trying to get rid of that kind of thing, and at least in my experience, they were not very helpful, because they just don't know.
yeah.
We had lots of ideas when we were talking.
I bet.
We just laid it out that this is what we found, and then need to figure out what would be some things to implement there.
For an epidemic that last year killed 90,000 people, that's 3
Wow.
months worth of automobile crashes. It's remarkably difficult. Mary and I would sit and go to a city website and do medication disposal, get nothing, drug disposal, opioid. And each city, we'd have to go through this, and each city, it would seem you'd hit the jackpot with a different search word. The only way to find that information is to really want to find it.
It was interesting that once you did find it, it was pretty consistently part of the police responsibility in terms of the disposal of it. There might be a reason for that, but that's just where it is. I've asked a couple of friends of mine and myself, I'm not sure if I would just think of calling the police to get rid of it, So that was interesting. But
Does the Edina Police Department take them?
Yeah, they have the bags. It's not a.
Charcoal. Yeah, it's activated charcoal, so you put them in there, and I think it's either you put water in first or you put the pills in first, and then you seal the bag, and that's it. It deactivates.
and they're available free.
Yeah, and you could fit a fair amount in one.
I don't have
We
it.
don't know.
I don't have it at disposal.
It's like 90 pills, I think.
Yeah,
You can fit in
you
one.
can fit all, I mean, it's.
Mm.
I've done it when I've had people that pass away and you want to get rid of all of their medication, so.
Yeah.
So the next step for this is like a motion to submit to council, kind of, and then that can be developed and submitted, and that would be it.
Can I comment on something? So just for number 3, I know just out of experience, I don't think that it's, the health classes don't emphasize the problem. I think it's more like the information is outdated and it's less like action steps. So when you move to specific recommendations, I would say focus more on updating the information and actual steps that people can take. Cause I know right now it's just a lot of history, oh, this is when it happened, but not this is why it's a problem now.
And I can speak to that too, because right now I'm taking the summer health course in Edina, and we're in that unit right now, and a lot of the information coming at you is this is really bad, you shouldn't do it. And then there are no resources at all for a lot of things other than opioids, but that's it.
So.
Well, yeah, that would be the next, so if this is submitted and council comes back and says, okay, come up with some recommendations. I think that's great to work that into the next, that's kind of the next phase. So it's kind of a two-part process, I think.
So do we have to officially have a motion to send to council?
It'd be good, I think.
Okay,
And then somebody can volunteer to put it in the right format. Or put it in, well, I can just do that. And then, I'll submit it.
So move.
Second.
anybody opposed?
So it's
Everybody approve?
Aye.
Better.
We're getting there. We're a little rusty.
Thank you.
Okay. Okay, any other initiative updates that people want to mention?
You and I had to talk about ours.
Yeah, so initiative one, Flip and I talked about it, last week.
Yeah.
And we should have hopefully something for the next meeting.
Okay.
Focusing on, the research and report out. And, you know, with this initiative, I think there's a lot of things that there's a lot of scope creep.
I don't know what that-
And you don't, it's okay, so if you start with one, it's like, okay, my kitchen stove broke. Do I get a stove? Do I get every single new appliance? Well, if I'm getting every new appliance, then I might as well just redo the whole kitchen. So it's like, you start with like one little thing and it gets like really, really, really big. That kitchen thing might be a personal example. So.
Sounds heartfelt.
It was. So just kind of making sure that we're focused and, hopefully get something by next meeting.
Yeah, we've looked at what are some of the things that we can do in terms of bringing some others into.
Yeah, and I think that speaks to the scope creep. So when we're talking about one thing, so social connectedness, when we're talking about it, a lot of things seem to possibly align or could be worked together with the human rights and relations and
Mental health.
Yeah, mental health and that sort of
Mental
thing.
health.
Mhm.
Yeah, actually, one of the things that I sent to Julia in a separate email. There's a word that's been going around even the autistic community lately that seems to apply to a lot of things. It's called intersectionality. Because now we're dealing with BIPOC and we're dealing with various groups and things. And so in terms of looking at social connectedness, I think my thinking is that maybe with the Human Rights and Relations Commission, there may be a way to bring the social connectedness and the human rights angle in with it together to basically talk with, because we've got disabled individuals, we've got mental health issues, we've got, many things that we could bring into it. So I think where our conversation was going is that, and please tell me if I'm mistaken, but it sounds like we're talking about intersectionality and how all of these can kind of intersect with each other.
Yes, and for the purpose of this year is the research and report out. And then I think it might be similar to what we're talking about with the opioid epidemic, is we report now, and then for the next year, it sounds like, that's when we can really talk about,
Right.
recommendations and stuff. So I think,
Yeah.
riding your coattails a little bit on that
Yeah.
would be a good thing.
Yeah, and we were talking about, as far as the Vitals app was mentioned, talked about us, because the issue for me is that I need to, in order for me to write up something for that, I need a format, I think, from you as to how I can set that up so that when I write it up, it will basically follow whatever, I don't know what if there's a protocol and a report that happens when communicating with our city council, that way I can kind of follow that format and make sure the information goes where it's supposed to. Because, you know, we're really ready with the data part. And then, you know, I can take the report that I did with my research study. And then, as far as funding was concerned, I'm gonna be reaching out to the vitals to just get another cost on how much it would cost to run it. And then I, as per your suggestion, we would put in there that maybe the funds from COVID-19, the American Rescue Plan there, could be used to help fund that. So I think that was your suggestion, like a meeting or two ago.
Sure.
Yeah. Because the issue is going to be, as I've mentioned, the police department having to activate it, and then, you know, we really are going to need to, you know, I'm going to need to put in there for this to be successful. So, you know, might be for this to be successful, we will want some community engagement with the populations that will use this. Because I would not want us to pursue this and then we don't have the community support around it, and then it just doesn't happen at all. And then there's also and I still don't exactly know. I don't know, maybe the funding you have is part of it, but there's also the matter of helping people, some people with disabilities, to actually be able to afford a subscription. I don't really know exactly how to remedy that problem. But you know, I don't know what the answer to that is, honestly. But you know, maybe if we can at least get some things started with money ideas, but that's basically it.
Okay, yeah, I can send you the advisory communication template for going to council. So.
Yeah, okay, good. And I'll work on putting that together.
Sounds
Okay.
good.
Anything from initiative 2?
Well, we are meeting next week,
All right, sounds great.
so
Stay tuned.
and wrap it up.
Well, that's great. I just want to quick ask about a little bit. So any chair or member comments? Yes.
I don't think there are too many people left who were here 3 years ago when we recommended and the city council adopted the citywide ban on flavored vaping.
Mhm.
Some of you may have noted that one of the owners of Bobby and Steve's had an editorial comment in the Star Tribune about 10 days, 2 weeks ago,
Okay.
basically saying that based on one study from San Francisco that it showed that when they banned flavored vaping, the kids in San Francisco smoked more, whereas the kids in the surrounding communities smoked less, that therefore Bloomington should not adopt its flavored vaping ban. I wrote a response, but the Star Tribune in its wisdom decided not to print it. But vaping is still an important issue, and you probably, several of you have noted front right of the Star Tribune, page 1 today. Juul, the company that's by far dominant, essentially bribed a scientific journal to devote an entire issue, 11 separate articles, extolling the public health virtues of vaping. They paid the journal $50,000, and I have a suspicion that if things are looked into further, that some of the authors of the various publications may have also received some remuneration. But at any rate, keep your eyes on the vaping, and I'm surprised that by now we haven't actually been sued. The companies, J.R. Reynolds threatened to sue Edina for the ban, but I think what's happened is there are so many communities that have banned flavored vaping that it's like trying to pick out one gnat in a swarm of gnats.
Did they threaten to sue Hennepin County too for Hennepin County's ordinance, or is that somebody? I think somebody, because it's no flavor either.
So there was a suit right away. And it was like, was it the manufacturer? But they got one of our licensees to sign on to it locally, but it basically lasted like, it got thrown out right away. So, and that was the last we've heard of it, so. The Bloomington thing is interesting, because I mean, their next step is gonna be basically sunsetting all tobacco licenses. They will issue no more. You may not sell or transfer your tobacco license to a new owner. So if you sell your convenience store, that's it. Like the new owner can't sell
So
tobacco.
Speedway sold to Super America or whatever that, yeah, you
basically.
can't do it, or
So-
7-Eleven's buying them or
And
something.
then, so that, I mean, that's a big step. So, I mean, it's an eventuality, but it, it's not immediate, but that's pretty significant, so. Okay.
There was one article actually in Nextdoor about a year ago that was suggesting that the city of Edina had thrown a bunch of revenue away by doing away with all of that. There was all that revenue that the city was bringing in, and they just thought it was so stupid to throw that revenue away. Just saying, that's what I read.
Yeah. Interesting.
Yeah. And incidentally, I was telling Julia like last week that it was hard to believe, but there's two individuals who started a group on Nextdoor. Edina's organics recycling is a failure.
Oh, yeah.
And the thing is that the two people who started it, they're the only people in the group. That's all. There's nobody else in there.
Well,
You know?
you can buy 3-gallon compostable bags, 3-gallon size ones, which is like a kitchen tap at Costco, by the way, now.
Yeah.
Just so you know,
Yeah.
it's sitting inexpensive at Costco now.
Yeah, and that was, of course, and then once I saw that, it came out the bulletin from the city to tell how well that whole thing is doing. But but yeah, that whole thing is really silly. I haven't had a chance to announce it, but I will share with you that the Autism Society of Minnesota and another autism organization have teamed together to offer a free sensory friendly vaccine clinic, a COVID-19 vaccine clinic this upcoming Thursday at Awesome's office in St. Paul. They've organized it with the Hennepin Health Group, and they've been putting out announcements for people to sign up there, but they're gonna be showing up there on Thursday, and they'll have both the Pfizer and the Johnson & Johnson vaccines there. And so they put this all together. There's a group called, I can't remember. There was an organization for autistics from within the Somali community. They've teamed up with the Autism Society to present the clinic, and they're going to have language interpreters there, as well as people to basically walk them through the process and make sure that they get vaccinated. So it's one of those really exceptional things. And then this is one coming from me, but I had something rather exciting happen last night. My podcast has become a member of the National Podcast Association, which they just started up this year. It's an association of more than 1,000 podcasts all over the nation. Well, last night they had their first ever, they call it a podcastathon, by which they took several pieces of different podcasts, about 15 minutes from several of them, and put them all together in a 2-hour show. Well, one of those came from me. It was the one about autistic adults and our diverse gender identities, which was so incredible to me because the gentleman that I interviewed for that is a transgender, Black, Jewish, queer, autistic man. So he fits like all of those intersections, talking about intersectionality, he fits all of them. And the thing is that he shared a story about what being autistic and being with all of those groups meant for him. And they put a little piece of that interview into that whole thing. I was really, really proud of that. And just, it's amazing that, you know, like I said, I only started this in January and already it's going to places like that. And not only does it go there, it actually goes all over the country. And then what was really interesting is that one of the podcasters is called Go Ask Your Father, which is a podcast about dads, fathers, and that sort of thing. The podcaster, their son was just diagnosed with autism like 6 months ago. And he just happened to ask me, he said, "You have one?" I was like, "Yes, I do." So he's become interested. So I'm just amazed with how well that's doing in terms of getting that kind of a response. So those are my remarks for tonight. Yeah, sorry. Thank you. Yeah.
Yeah, I can go, like I mentioned this to Julia a couple of weeks ago, and actually I just talked to Jeff about it today, just to kind of make sure it falls within our scope, but kind of as we're all starting to wrap up this, the initial projects that we were tasked with for 2021. And on the heels of the meeting with the mayor and city council staff, like one of the things that they had sort of highlighted for us bringing out of the parking lot was mental health. So again, I kind of pull from our own areas of expertise. And so one of the things that I thought might be interesting is just through like some professional connections, I know some individuals that I think would be able to put together an interesting presentation on the mental health corresponder models. Like they actually were responsible for basically the research and design and implementation of both the pilot and then an actual fully funded model in a neighboring city. That was, very successful and very well received. It's actually something that's kind of happening like pretty expansively nationwide. There's a variety of different ways that it works, but the general kind of concept behind it is that for police calls with individuals that are in some state of crisis or have mental health issues, it provides trained personnel. In some cases, there might be people that are just on dispatch that can talk them through something. Another one is actually the correspondent model where they go out together as a team. There's other ones where, they'll just, for these kind of things, they'll just dispatch like an actual separate unit of mental health co-responders. So I feel like it's something that's kind of very interesting and very relevant to this, the current period of time. The other fairly interesting thing about it is that, obviously there's a lot of, it's a diverse array of opinions as far as, policing in the country, but this seems to be something that's generally pretty well received by just about everybody. The officers that are involved, appreciate having people that are there that are trained in this specific, area, since it can be one of the most, stressful and like conceivably dangerous calls they can respond to if they're not able, trained to deal with it. So just kind of having those, extra people to accompany them on these calls ends up being a very, very helpful thing for everybody involved. So, but again, with that in mind, you kind of said it was something that, I don't know where interest is at, so I figured I'd throw it out there to the group and kind of let people weigh in. And if it's something people want to do, I'm like happy to reach out and see if we can have somebody come in, just kind of for, again, like the whole purpose behind it is just informational. It seems like it's something that's kind of, in that same vein of the mental health and mental wellness work at this current point. So I figure if there's, majority of interest there, like I'm happy to try to set something up just to like provide some materials and talk to the group about kind of what their experience was with, what they learned, what they, kind of lessons learned from doing the research and talking to other municipalities and, that's kind of what it was like to implement this and what they saw.
I think it'd be interesting.
So the COVID money that's coming down, is any of that money going to programs like?
I do not know what the city's plan is with the rest plan fund. I haven't seen the breakdown or any of that, so that's a administration thing.
Hennepin County just reassigned one person to help with how to distribute all of that money.
Can track its spend.
Yeah.
Yes, that's the important part.
Yeah, no, it is. There is like a complete reassignment of an employee.
We have
Just
just
just for that. So I'm sure that there's something similar going on around here. Yeah, I think it'd be great.
yeah.
Okay.
Part of that project is that connectivity also?
With, we just look at like the correspondent model in general.
Yes, and then people that feel isolated, how do we get? How do we
So-
get those people, right?
Yeah, so I mean, again, there's, I can kind of only speak to the, immediate ones that I'm more familiar with, but I know nationwide, there's a variety of, I guess, of points where the correspondent model is introduced. Some of it actually it involves around incarceration. So when at people's reentry point, it's like there's a connectivity thing there, I suppose like when they're coming back in, it's like that's where they actually assign, most people just get a probation officer or something. And that's basically when they reestablish contact with law enforcement. And at that point, they introduce it. I think it's Denver that might do it that way. But then in terms of, the communication that's extended beyond like their point of interaction. So if there's a call on somebody that's, in a moment of crisis, that person responds. As far as what happens after that, I think that's something that's definitely, worth asking.
Right.
In terms of just, keeping tabs and making sure that that person's able to get, to receive the support and help they need.
Usually they have a social worker that,
Yeah,
so,
in that case, if they did, then I think that's something where they do connect with, so if there's an assigned caseworker or something for that individual, just to identify the larger issues at play. Because upon the initial interaction is more just trying to de-escalate the situation, with somebody that's trying to identify what might be the, what might actually be the situation playing out. But no, it is really interesting, and it's like I said, it's something where I feel like it's fairly unique because as far as pushback, it doesn't really come from some of the places that you might expect. Do we, again, just to be diplomatic and democratic about it, do we want to have?
So do you want to vote? Everybody in favor? Aye.
Aye.
Anybody opposed? All
All
right,
right,
awesome.
cool. I'll reach out, see what I can get.
Any other comments? If not, we can move to staff comments.
I will not be here in August for the meeting,
So maybe we should not do that in August.
All right.
so I will be fishing.
Nice, good for you.
So I will try to have one of my staff people run all of this. After tonight, I'm a little, we'll figure that out. I might have to have MJ do it or something, just so she can see how this all works, but I will figure that out. So
How long can we be virtual or? is-
the next meeting is it.
Oh,
So basically, this whole setup only will happen for 60 days after
Okay.
the emergency orders were lifted.
okay.
So
So one more.
So basically, this meeting and the next meeting. After that, it's in person or it counts for attendance and stuff.
Yeah.
So. We're in this weird in between.
It's municipal too, though, right? Because for Minneapolis, they're not going back yet because the city extended its own.
Also, they have their own
Yeah.
agency thing.
Yeah.
So yeah, so that's probably different, but. And it's only for elected positions. So like if I was at home, I could still run the meeting if it all worked, or basically
So
what
you
we're.
can do it while you're fishing.
There's a little bit of discussion with council meetings for like, say I'm gonna do a presentation about, say I'm gonna bring advisory communication to council and I'm gonna say 3 minutes worth of stuff and submit it. But I'm like 15th on the agenda, so it's at 9:45. I would have to be here and then do the presentation and go home. Whereas we're talking about the possibility of staff being able to log in or something and then give the brief presentation, and then council is there person and then they vote. So I'm not sure where that's gonna go, but they're talking about it. So it would help staff a lot. Otherwise, I don't really have much else.
If staff are going back and forth, I feel like that could be a reduction in your carbon footprint if you go home
Yes.
once and you stay there.
Yes,
Just, give it a little.
yes. Okay, I do have one to say.
Yeah.
Umbrellas for you all, except students. I have something else for you guys. So you have to come next week. Grab these on your way out. These are what you would have gotten if we did a commission member dinner, like we normally do. Appreciation thing. So I'm not really sure what it looks like. But grab it on your way out.
Cool.
That's that.
Jeff, is there any conversation about a hybrid
like forever.
Mhm.
I think
Or
it,
optional, you know, it just seems like that, eventually, there's so many conversations like that going on.
yeah, I think we would take the cue from the state, you know, if they change, because it's a state rule. We're just following the state rule.
It's just a rule or a law.
I think
I think it's a statute.
it is, it's weirdly restrictive. Like we've looked at it and like to a point that it's like, yeah, like I think if you wanted to do stuff remote, we have to, you'd have to be available. So like, if I want to go, you know, if I'm not on this commission and I want to take part in it, I can go sit in your yard and like, just, you know, like watch the meeting. Like there's literally part of it that says like you have to be in a space that's like publicly available.
Right, like, so if you, like, after the 60 days, if you said, I need to be remote. You were at Starbucks itself,
Yep.
we would have to post.
Yep.
In advance, Mary's gonna be at Starbucks in Southdale at this place. So if you wanna come and attend the meeting where you are, they can, the public can do that. I mean, obviously, that is more of a council thing, but it applies to our boards and commissions too, because it's a, you know, there's the elected position or whatever.
Yeah.
So I mean, obviously, that's a pre-COVID kind of thing, I think. I mean, I would imagine that's gonna be a discussion point all over the
Yeah.
place. But right now, we're following that. It'd be nice if we had this up on the ceiling and it just works great, but right now it's temporary because we don't know what's gonna happen after 60 days, so we didn't want to, you know, totally change all of this. I'm not sure, so that's where it's at. It's probably gonna change somehow in the future.
Well, one of the conversations is that a lot of the virtual platforms that are being used now, one of the ideas behind them was actually to allow people with disabilities to be present for things. And COVID-19 kind of co-opted all of that. And so, needless to say, now that people are starting to attend in person again, they're wondering, will this stuff be actually remain for people with disabilities? Because I think some people are looking at it as, suppose somebody with a disability wanted to be part of this commission, but they couldn't come out or they couldn't access for whatever reason, that might be a sort of thing that could be written into a statute, that if you have somebody who actually cannot access, then that's how they can participate. But, you know, those things haven't been clarified by statutes yet, but they are thinking that now that COVID-19 is passing, that, you know, what will happen, I mean, the platforms will still be there, but exactly how they get used and who uses them will be the issue.
Right, it's a decision by the organization, in this case, the city. Do we spend the time and effort to have what's the, I don't know, what's the trade-off?
Yeah.
And all that, so, but things are being discussed.
Yeah, and those platforms do require money in the budget to be able to pay for them, to be able to use for X number of people, so, you know, I use Zoom for most of my virtual interviews. I actually had Cisco WebEx for a while, but actually the reception was not nearly as good for some reason.
And from a tech equity perspective, you have to remember that not everybody is technically either savvy or has the equipment.
Exactly, yeah.
That's the part that I think particularly here, we tend to forget sometimes, but.
Yeah, in other words,
There's a accessibility issue.
yeah,
Equity is a huge issue when it comes to technology.
yeah, so therefore, if there's somebody who can't access that, then that's part of the problem.
All right, if there are no more, Jeff, anything else?
Nope.
All right,
I move to adjourn.
I second. All right, anybody opposed? All right. Thanks, Rob.
Thank you.
Good night.
Technically supposed to second.
Oh, sharing. I'm going. You're good.
See
you Monday.
I was tempted to ask if.
Yeah,